Hey, this is Doug Field along with my co-host Brent Macy, and welcome back to the segment of Healthcare Consumerism Radio. And joining us on the phone today is one of our newest affiliate members, Randy Cox, CEO with Pricing Healthcare. Randy, good morning.
Good morning. How are you?
Good. We're fine. How's Utah today?
Pretty good.
Good.
The weather's turning cooler, and we're nice out here.
That's great. That's a beautiful country out there. Randy, great to have you on the program. I think you're doing some really interesting things around direct pay. Talk to our audience. Give our audience a little backgrounder on yourself and Pricing Healthcare, and then we'll talk a little bit more about your specific solution.
The thinking was there's no way we're ever going to get prices from facilities themselves. Hospitals and surgery centers are just too tight-lipped about their rates. So our initial focus was on crowdsourcing some data and trying to get some government data from states like California. And then that all changed when hospitals and surgery centers started calling us and asking us if they could publish some of their prices on our site. And it took us a little bit by surprise, but we knew that was a far better way to get prices out in the hands of consumers and employers. So we changed our focus at that time. And this year, since the beginning of this year, I've started working with facilities directly and publishing their direct pay prices on our site.
Now, Randy, this is Brent. How big is the market for direct pay healthcare?
There are a lot of people, many of them very educated people, who, when they hear direct pay healthcare, they think just of the uninsured. Mm-hmm. Although, granted, that's a 40 million person market by itself. It's bigger than that. Direct pay also affects those with high deductible plans who have individual plans, including those on the exchanges. And if you figure, you're not going to reach your deductible in a year, some deductibles nowadays can be as high as $10,000 to $15,000. Mm-hmm. A lot of Americans don't hit their deductibles. All those people are realizing that they're paying cash for everything. Mm-hmm. So, but this is still not the bulk of the direct pay market, even though it's 60 to 70 million Americans. The bulk of the market is employers, self-insured employers. There are probably 100 million Americans getting health care benefits from self-insured employers, and they're looking en masse for direct pay as an option to lower costs. Some of these employers would love to see everything go direct at some point.
Mm-hmm. Now, Randy, and then I'm seeking to understand if I'm an employer looking at direct pay, do I have more negotiating power with the direct pay option? Is that a benefit? What are some of the benefits to the employer for the direct pay options?
So there are a couple strong reasons an employer would go with direct pay. The first is employee choice. Insurance networks are shrinking nationwide, and that's just reality. It's not just the exchange plans. Insurance carriers are limiting their networks to lower cost and various other reasons. But the result of that is employees have fewer choices, and employers are concerned about that. Direct pay opens up.
We lost you there, Randy. You still there? Doug, I think we lost Randy. We'll get him back on the line here in a second. But I think you and I talk about direct pay, a lot, and really where the market's moving, and the whole space, whether it's direct pay, whether it's concierge medicine, there are a lot of different solutions out there that are really changing with this market, right?
That's exactly right. You see a lot, what he was alluding to too, from an employer standpoint, and one of our keynoters, Jeff Ellis, CFO of MGM, will talk about what they've done is they've set up their own networks, and that's really direct pay. That's removing the third party payer. You've got concierge medicine developing. That's really direct pay. You're paying the doctors directly for a set of services. Mm-hmm.
Now, I think when you look back at the direct pay and where concierge medicine, I think that's an access to care opportunity more importantly. But then with direct pay, some of the things, and we're going to get Randy back on the line here. I think we lost him there for a second, but. Pricing healthcare, with different contracts and the health plans and what's their role in this space, as we heard our earlier guest talk about it. Randy, did we get you back? Don't have Randy back yet, but he's going to be coming on the line. We got him calling in right now. But we're going to talk a little bit more about Randy's business model here, too, in the segment. And, Randy, you still there? You there with us?
I am. Can you hear me now?
Yeah, sorry about that. I think we lost the connection there with you, but you were talking.
My apologies.
Oh, that's okay. You were talking a lot about choice as a benefit to direct pay. I think that's where we lost you.
Yeah.
So continue on.
Employee choice is a big reason for employers to go with direct pay, but the far bigger reason is the savings they can gain. You know, it may surprise a lot of people. Employers that are paying direct for health care can sometimes get much cheaper rates than going through insurance.
Mm-hmm.
The California pension and retirement system made some groundbreaking changes a few years ago towards reference pricing, and they saved themselves $5 million in 2 years on just a few procedures. If CalPERS had sent those same patients to facilities on our site, they could have saved $5 million or more in addition to that easily. The rates are that much lower
mm-hmm.
than what they're able to get, even by playing hardball with hospitals through insurance.
Randy, we see the growth of concierge medicine a lot, and providers really establishing practice with the concierge medicine, a subscription model. Is that a part of your offering too? Are you going to include them as part of your offering?
Are you talking about primary care?
Yeah, primary care.
Yes, we will be adding that in the future.
Mm-hmm.
There are a lot of direct pay primary care physicians, and they are wanting to, not only move more completely to direct pay, but also advertise to individuals and to employers, and kind of connect the dots there.
Yeah, you become a very
over the next year or so.
Yeah, you'll become a very valuable service to them. I can see that connection as well as to the employers and to the individuals. What's your business model, Randy?
So we see ourselves as kind of this large pavilion where anyone selling any type of healthcare services and procedures can pay a small fee and set up their tent or their booth, if you will,
mm-hmm.
and then we let everyone else come and browse for free. For consumers, for employers, it's totally open. They can go from one facility to the next. They can see what's available in a state or in an area or nationwide, see how rates compare, see how quality compares, things like that.
Now, Randy, when you kind of look at the market competition out there that you may see on RFPs out there, how do you differ from some of your competitors out there that might have a similar solution to yours?
Sure. Some companies out there actually are kind of like a bulletin board to show some prices,
mm-hmm.
and we actually partner with our providers as much as we can. We don't believe that healthcare is a race to the bottom in terms of price. Patients are not interested in having their healthcare cheapened. In terms of direct pay with employers, there's a company, Employer Direct, which is growing and dealing with direct contracting in this market. We feel like direct contracting is only a half-baked solution.
Mm-hmm.
It does remove insurance from the picture, but then it adds back an insurance-like party. In fact, Employer Direct calls themselves a narrow network.
Mm-hmm.
So it's really, they hide their prices, and only a select few have access to them, whereas Pricing Healthcare has a completely open platform that uses competitive forces to expand and reveal a lot more prices. And we do away with the contracts altogether.
Mm-hmm.
So there's, it simplifies the process a lot.
Now, Randy, I'm sorry, go ahead.
Nor do we charge a fee. A lot of our competitors charge a fee for employers to access prices and to find lower cost care. When we don't, it's completely free.
Now, Randy, when you look at the HSA accounts that are out there, I don't know if you heard our previous guest from Wells Fargo, Liz, talk about the growth in their HSA business. But with your model, is an HSA, is that an eligible expense within this model?
Certainly, yes. The direct pay model deals with cash pay up front. Individuals are often encouraged to go this route because it's so much less overall for the employer. HSA can certainly be part of that. What we've seen, though, is that the savings are so great for employers that most of them are giving their employees incentives such as, we'll pay 100%, and it won't touch your HSA at all. That's how big the market is. That's how big the savings are.
Okay, Randy, you're promoting this direct to consumers as well as to employers. Is that your model right now?
That's correct.
Okay.
The providers on our site require consumers to pay 100% cash up front
Mm-hmm.
to get the prices we list. Employers have an option typically for 30 days, same as cash. But we are targeting both employers and individuals. We think if a large company, a Fortune 500 company, is able to get rock bottom rates by going direct with a facility, that the individual should have access to that same pricing.
Yeah, it would appear that your solution is a natural fit, too, with these emerging private exchanges. Are you in dialogue with some of the private exchanges?
We aren't yet. We're still kind of building out our map.
Okay.
So we have enough providers to service the various areas in the United States. But it does make sense when people have such high deductibles for them to be steered towards places where if they're going to pay direct, or if they're going to, if they're concerned about a really small network and they're going to pay, they have a high deductible, it makes sense for them to be shown options where they can get affordable care.
Now, Randy, as you kind of look into your crystal ball, where do you see the market moving, 5 to 7 years from now, relative to your solution set?
Boy, I'm just trying to get through the month here.
Yeah, I agree with you, Randy.
The number of providers who are interested in what we're doing, and we talk to hundreds, acute care hospitals, surgical hospitals,
Mm-hmm.
surgery centers, imaging centers, they are all very interested in what we're doing. Very rarely do we find someone who says, we're not interested in that. Some of them have other things in the pipeline they have to wait on. Some of them are waiting for an employer to say, hey, we want to send our employees to your facility. But generally, the adoption is growing and even accelerating. And as one hospital comes on and says we want to publish our prices, usually neighboring hospitals pay attention, and we see kind of this groundswell, this domino effect where more and more facilities are going to be publishing their prices. And they're getting very creative. It's surprising how many people are bundling this or that, or saying we'll give you this discount if you'll do this. They're freed from all the regulation of insurance, and they're offering some great deals. And so we really see an explosion of this. What it means, we think, is that insurance will return to being used for catastrophic things, and that there are better models available in this country for paying for care direct, whether that means an HSA or a stipend or a tax credit. I don't know what the solution is there, but there certainly is a big interest in this because it's so simple. It cuts so much of the expensive overhead out of the picture, and Americans are just very interested in this, and providers, they are so in favor of this model. They're really getting tired of the overhead, the paperwork, the collections they have to do on the insured model, and employers are very interested in the savings. So this could really transform American healthcare, and we're not talking about doing away, going back to the Wild West and doing away with insurance or Medicare, things like that, but there certainly is a big place for this in the country.
Hey, Randy, we really appreciate you joining us on the program today. Hope you have a great weekend out there out west, and if you can make it to IHC Forum West in Las Vegas, we would love to have you. And to our audience, Randy and his company is an IHC affiliate member, so you can find information on our website. And to everybody else, we'll talk to you next Friday on Healthcare Consumerism Radio.